Thank you, Rebecca. Hi, everybody. I am Laura Kellums. I'm the Northwest Arkansas Director here at Arkansas Advocates for Children and Families. I'm joining you from Springdale today, and I'm joined by my fellow panelists, Whitney Tucker, who's the Director of State Fiscal Policy Research at the Center on Budget and Policy Priorities. The Center on Budget and Policy Priorities has been a really close partner of ours, and they're really the national experts on the impact of this bill, especially on low-income families and on the unfairness of the tax policy in it. So we're really pleased to be joined by one of our national experts in this area with really wonderful partners that we have. They're based in Washington, D.C. And also joined today by my colleague, Pete Guess, who's the Economic Policy Director here at Arkansas Advocates for Children and Families. He's joining you from our Little Rock office today, and I'm in Springdale, and Whitney's in DC. So through the power of wonderful technology, I'm glad we can all come together to talk about this important issue and share this information with y'all. I'm going to get us started with just a kind of an overview of the work that we've been doing on this. And then Whitney is going to talk about specific state level impacts and more information about the bill. And then Pete is going to walk us through some maps that he's been doing some great analysis of how this bill will impact Arkansas at not just the state level, but the local level as well. And he's going to go through some of those and share those with y'all so you can see how to use those in your own work. So I'll go ahead and get started with some of that background. And I accidentally went too far. Sorry about that. So at Arkansas Advocates, we work to ensure that all people have the resources and opportunities they need to thrive, and that especially low-income children in our state, the types of resources that they need to thrive. And so this bill was very important to us, and trying to stop this legislation was very important to us because of the drastic impact that it will have on low-income families. And it's really, even bigger impact in a state like Arkansas because we do have higher poverty rates. We have the 5th highest child poverty rate in the nation. We have the nation's highest hunger rates, the highest food insecurity rates of any state. And so when cuts are made to programs like SNAP and Medicaid, they have a really huge impact here. And that's why we worked so hard, not only to try to stop this bill, but to mitigate some of the damage. And we did have some success. Believe it or not, it could have been worse. And so we'll talk a little bit about some of that here in a bit. But as a reminder, even though we make all these drastic cuts, this legislation actually adds to the national debt, increasing that by trillions of dollars over the next 10 years. And Whitney will go into some of these details, but just so you know, like people might be wondering, like how exactly will people lose their SNAP benefits and how exactly will they lose their Medicaid insurance? And so here are some of the ways. So changes to the work requirement. We already have a work requirement in SNAP, but older Arkansans will be required to take part in that work reporting requirement who didn't have to before, as well as parents. The bill passes on huge costs, tens of millions of dollars to the state to keep the SNAP program going. And then, of course, you've probably seen that many lawfully residing immigrants will lose their access to the SNAP program. And then on Medicaid, some of the same types of changes, except that many of them will happen later. The work reporting requirement, we haven't had that nationally. Some states have experimented with it, including Arkansas, and we're kind of the poster child about how this really doesn't work very well because even people who were working lost their Medicaid when we did this in 2018. But we will be doing it again, and this will become a federal requirement. And so we'll see people lose their coverage that way because they might not be able to go through that bureaucratic system to prove that. And then people will have to redetermine or sign up again, re-up their coverage more often than they do now. So these are just more opportunities throughout the year for people to lose their coverage. And then again, cutting folks off who are lawfully residing immigrants. And we can talk more about that in a bit. And then another important way that people may lose their health coverage is that the law didn't extend enhanced premium tax credits. You may have seen some information about that, that this will cause people to not be able to afford their private insurance that they buy if they buy private insurance on the marketplace. So 130,000 Arkansans have that kind of coverage. They won't all lose their coverage, but their prices will go, what they have to pay in premiums will go up. And we know that tens of thousands of people in Arkansas will lose their coverage because they won't be able to afford to buy that. And just a timeline. So, this is kind of going to be rolled out over a couple of years. And so beginning very soon, immediate or in the next few months, we'll see those new time limits and work reporting requirements in the SNAP program. That the SNAP program will be where we see changes first. And so we'll be watching how the state rolls those out. And that's when many lawful immigrants will lose their access to the SNAP program just in the next few months. We're not really sure exactly when it's going to be happening, but we're going to watch closely. The state is waiting for guidance from the federal government. And then we'll see this fall, people start to see how much their health insurance is going to go up if they buy health insurance on the marketplace. And then beginning in January, some lawfully residing immigrants will lose their access to be able to use those types of tax premium tax credits at all to buy their health insurance. We'll see that as one of the first waves coming in January. And then about a year from now, a really important, something we need to be really advocating for at the state level, the state will have to pay more to administer the SNAP program. Even though fewer people have access to it, the state will have to pay a larger share of the administrative costs. And at the state level, that's going to be $22, $23 million. I know Whitney's going to cover that a little bit more too. And then beginning about a year and a half from now, we'll see the federal requirement for those Medicaid work reporting requirements. And the state will actually probably implement those sooner because we already have a request in to implement something like that. So we'll be watching over the next year. That'll be when it's definitely required, but Arkansas will actually put some of these restrictions into place before that. And then more restrictions on lawfully residing immigrants. And then a really big bill will come due in October 2027 when if this were implemented today, Arkansas would have to pay another $55 million just to keep the SNAP program going on top of that $22, $23 million that I mentioned before. So these will be annual costs that will combine. And this is something the state has never had to pay before. And so that will be on that timeline. We'll be watching for that in a couple of years and need to be advocating much sooner for that. And then in late 2028, there'll be new requirements on Medicaid that could cause people to have to pay every time they go to the doctor when they don't have to do that today. And then 3 years from now, some of the popular tax cuts that are part of this bill, part of this law, will expire, like the ones on tips and overtime and tax cuts for seniors. Those will expire while the tax cuts for wealthy people and corporations will remain in place. So we'll be watching this rollout over the next couple of years and be advocating along the way. And I'm going to turn it over to Whitney, but I will come back after Whitney talks and just talk about some really specific opportunities for advocacy at the state level. But with that, I will turn it over to Whitney and I'll be back. Thanks.
Fantastic. Thank you so much, Laura. So first off, I would say I'm really thrilled to be here today. Looking forward to the Q&A. I won't say too much about the Center on Budget since you've given such a great intro, and we're just going to move ahead and dive right into this content because there's a lot to cover here. There we go. All right, so the budget reconciliation bill passed by congressional Republicans and signed into law by President Trump on July 4th is going to raise costs on people and families in a lot of different ways that Laura just kind of overviewed there for you. I think it's most important to note that this bill is raising costs by removing people's health coverage, food assistance, other essentials away from people who were already struggling to make ends meet, all while kind of showering even larger tax breaks on the wealthiest households, which you can see in this graphic that I've included over to the right. The new law also really targets immigrants, including those who are lawfully present, including refugees and asylees and survivors of domestic violence and human trafficking. And it significantly expands investments in the larger detention and deportation machine across the country. The bill also dismantled really historic investments to curb climate change. And so, what does all that mean for Arkansas? We are about to dive deep, but I just thought it might be helpful to see some of the top lines all together, especially for folks who may not be able to stay on longer for today's presentation. So, leaning in a little here, this bill is going to raise costs and increase hardship for Arkansans generally. I mean, at a high level, a national level, as shown on this slide, the bill includes about $1.3 trillion in cuts over 10 years to SNAP, to Medicaid, and ACA marketplaces, which is about the cost of just this plan's tax cuts for households that have more than $500,000 in annual income. All right, so slashing this assistance is going to hurt a broad swath of families across all parts of the state through rising healthcare and food and energy costs. On the healthcare side, the cuts to coverage included in this bill come in many forms, but they all lead to the same place. So, huge reductions in coverage for low to moderate income people and additional costs, both direct and indirect, that the state and localities will have to shoulder. So, the Center on Budget estimates that more than 131,000 Arkansans and 15 million people across the country will lose health insurance by 2034 through a combination of cuts to Medicaid, marketplace rule changes, and the impact of the failure to extend those expiring premium tax credit enhancements that Laura mentioned. So coverage losses could be even higher than that estimate due to the red tape barriers that cause more people to lose their coverage than we might be projecting. Estimates also aren't accounting for people who maintain Medicaid coverage but lose access to providers or services through changes on the administrative side that make it more difficult for them to access. So, sort of, just laying it all out. So, first things first, this bill creates a sea of new red tape, including harsh new work requirements and ACA marketplace restrictions. It could leave tens of thousands of Arkansans in the expansion population at risk of losing their health coverage, now including parents with children over age 13. There are more frequent redeterminations for expansion enrollees. It's now twice a year rather than once. And there's mandatory cost sharing on certain Medicaid enrollees that the state has to implement. The failure to continue the enhanced premium tax credits that help low and middle income families and small business owners to afford health coverage are very likely to result in skyrocketing premium costs for Arkansans who get their health coverage through the state's health insurance marketplace. So, for example, under the bill's provisions, a 60-year-old couple in Arkansas making $82,000 would see their annual premiums for a benchmark plan in the marketplace increase from $6,970 to over $23,000. Current estimates indicate that 49,000 Arkansans may lose their health coverage altogether just due to the increased premium costs. The bill also strips access to coverage from many lawfully present immigrants in that group that I mentioned before. So it takes away Medicare, federal funding for Medicaid, affordable ACA marketplace coverage, and affordable ACA marketplace coverage from people who have been granted various different humanitarian protections, including those refugees, people granted asylum, and then certain victims of domestic violence or sex or labor trafficking, among other people who are lawfully living in the U.S. It also restricts federal funding for Medicaid and CHIP coverage to most categories of immigrants, and it cuts the federal matching for emergency service costs that are provided to individuals who would otherwise be eligible for Medicaid if not for their immigration status. The bill also really sharply restricts states' ability to finance Medicaid through new caps on provider taxes and delays in provider tax cuts, which reduce state revenue. And on top of that, there are the many indirect costs that the state will need to try to address without decreasing access to or quality of care for the vulnerable populations that still need it. Right. So there will be a surge of newly uninsured people, leading to more and costlier uncompensated care, which threatens hospitals and clinics, especially in rural areas. Also, higher administrative costs in order to enforce these stricter eligibility requirements. And in the absence of some other revenue raising strategies at the state level, it is going to leave Arkansas and other states trying to address shortfalls in what are likely to be very harmful ways, right? So things like reducing reimbursement rates to providers, which limits access over time, or eliminating services that are non-mandatory, including things like dental care, which people obviously still very much need. Now, turning to SNAP, here are the main things to know. So this is the largest cut to SNAP in history, and the unprecedented cuts to food benefits could result in higher grocery costs for up to 240,000 Arkansans who receive food assistance through the program. The bill requires most states for the very first time to pay between 5 and 15% of SNAP food benefit costs. And if Arkansas's lawmakers can't meet this unfunded mandate, they are going to either have to reduce the state's costs by cutting the number of people who can receive SNAP or opt out of SNAP entirely, which would leave Arkansans without the food assistance that they need to buy groceries, and it would negatively impact grocers, also, especially in rural communities. Right. 25,000 people in Arkansas would be at risk of losing some of their food assistance, including many children, under a significant expansion of SNAP's already harsh and ineffective and red tape laden work requirements for parents and other caretakers of children ages 14 and up and adults aged 55 to 64. In addition, the state can only waive the work requirement in areas of the state where the unemployment rate exceeds 10%, even during a recession when unemployment rises significantly but does not meet this extremely high level. The bill also eliminates the current exemption to the work requirement for veterans, for people experiencing homelessness, and for youth who recently aged out of foster care. And in a really cruel turn, the bill really takes away food assistance from people who have been granted those humanitarian protections that I mentioned before. For reference, in 2023, there were roughly 434,000 people nationwide participating in SNAP who were admitted as refugees, granted asylum, or granted withholding of removal, which represents only 1.1% of program participants. But they are specifically called out and the benefits are stripped through this bill. A bit more on the math here. So historically, SNAP food benefits have always been 100% federally funded, as I said. And the new cost sharing with states is based on their error rates in the SNAP program. And while these are, sometimes billed as related to, waste or fraud, when they've actually been studied, most of the time these are just human errors in filling out paperwork or filing it on time, right? But administrative costs are also rising because of this bill, where the state and the federal government used to share costs for administration of SNAP 50% on one side and 50% on the other side. That's changing so that now the state is going to have to cover 75% of the administrative costs in addition to the new cost share based on the error rates. So if a state can't pay its new match amount that's based on this error rate, federal funding will also shrink, which will lead to big benefit cuts. The bill really incentivizes cash-strapped states to either cut other spending or raise taxes to fully meet the requirement, to find a way to cut the number of eligible low-income households who receive SNAP so that the state can afford to pay their share of the federal benefit of all households that remain in the program, or opt out of SNAP entirely, which would leave those 240,000 low-income Arkansans that I mentioned before without food assistance. Starting in October 2027, states that have an error rate less than 6% would not be required to pay any portion of the cost of allotments, and the federal government would continue to pay 100%. States with a 2026 error rate that was at or above 13.33% would not owe a cost share until fiscal year 2030. The rest of the states could opt to use their 2025 or 2026 error rate in order to determine their cost share. The breakdown is sort of, under 6%, 0% paid by the state, 6 to 7.99% is 5% paid by the state, 8 to 9.99% error rate is 10% being paid by the state, and an over 10% error rate would lead the state to have to pay 15% of SNAP benefit costs. And so starting in 2028, that's going to be based on those 2026 error rates for most states, unless they elect to use their 2025 rate instead. That was a lot, but I say it because it is important in terms of the amount of money that it's going to take out of the state. If based on 2024 error rates, Arkansas will be forced to pay a 10% match. The 2024 error rate was 9.56, and the state would have owed $55 million. If we're budgeting conservatively based on the highest potential cost share of 15%, Arkansas is going to owe $82 million. Sorry about that, little delay. And so while essential services are being cut, tax breaks for the wealthy that began in 2017 have been extended and will continue immediately in 2026. According to the Institute on Taxation and Economic Policy, Arkansas's top 1% will receive $756 million in total tax cuts for an average of $48,810 per filer. Extending that 2017 tax law is by far the most expensive tax provision in this bill, with overall costs in the trillions of dollars. But there are also some new, really poorly targeted priorities that I've listed on the slide that just further raise costs in the bill without providing broad benefits. So while Arkansas may need to shoulder more than $104 million annually to ensure that low-income families can afford food, the richest 1% of residents with an average annual income over $2.0 million would get a cumulative tax cut that is nearly 9 times that amount. So lowest income households will see a cut of only $110 compared to current policy. And it will actually be a tax hike of $30 if we factored in the extension of the failure to extend the premium tax credits that help those families afford health care. The child tax credit was also increased by $200 per child in this bill, but it still leaves behind more than 17 million of the country's poorest kids. 215,000 Arkansas children would get nothing from the 200 per child increase in the CTC because their parents, who work very important but low paid jobs, don't earn enough to qualify for it. So a single parent with 2 children earning $16,000 a year as, say, like a home health aide would get no additional credit under this bill, but would end up with a total child tax credit that was less than half the size of a higher income family with 2 children, who would see their total credit rise to $4,400. And benefits of the bill disappear entirely for everyone except the wealthiest 10% when accounting for the rising consumer costs due to President Trump's tariffs. And if all of that weren't bad enough, the mega bill also cut $480 billion to clean energy investments, which is going to have devastating harms to climate and energy progress, but will also just raise energy costs and make people sicker while propping up the fossil fuel industry. So this law attacks every single phase of climate action, from data collection to governance infrastructure to project finance and implementation. And it really dangerously slows the urgently needed transition to clean energy in favor of those tax cuts and the special treatment for wealthy that I mentioned earlier. It is disastrous for communities and takes the country in the wrong direction in terms of climate impacts that are increasingly threatening lives and livelihoods across the country. The Center for American Progress estimates that the termination of clean energy investments that would boost the supply of American-made energy is going to result in a national electricity rate hike with an average increase of $130 per year for Arkansans starting in 2026. We can also expect really disparate impacts by income level. Nationally, 1 in 4 low-income households already spends 15% or more of their income on energy bills. And then, not for nothing, but these historic cuts that are in this bill to health coverage and to food benefits are happening alongside a host of additional regressive federal policy actions that are going to have really significant implications for state and local finances, but more importantly, for the people and the communities that they support. Right? There's a cascading impact that includes all the things that I have listed here, right? But deep cuts in education and childcare and housing and other discretionary spending are also expected as a result of this year's appropriations process. And President Trump's recommended budget is expected soon. So all of these federal pressures on the state would be untenable in essentially any time because states are required to balance their budgets. But it is especially true in the current moment because state finances have already been showing increasing signs of strain in recent years, and things would only worsen if the economy were to tip further towards recession. So Arkansas has already been working in an already strained context for several reasons. First, most states have gone on a tax cutting spree since 2021, enacting a wave of oftentimes very large, very costly income tax cuts in the wake of COVID-19 and the unexpectedly strong economic recovery that followed it, which was due in large part to the historic federal response at that time. More than half the states have now cut income tax rates since 2021. And Arkansas has cut individual and corporate income taxes several times over the past several years. As a result of these cuts, the state is already losing about $1.8 billion annually in general revenue. Second, there has been a growing trend of revenue reductions for public education specifically, especially through the proliferation of local property tax cuts and caps, and a surge of new state programs that would divert education revenue to private schools and homeschooling families, and that's playing a really major role in driving shortfalls in a few states. This year, state level school vouchers are available to all students in Arkansas. And if all students who are currently in private schools in Arkansas were to participate in the voucher program, it's going to cost the state more than $200 million a year. And then third, pandemic era federal fiscal aid, so namely the two major pots of money for states and localities through the American Rescue Plan and for public education through a fund called ESSER, expired at the end of 2024, which had been providing a really major pillar of state and local finances over recent years. And that happened at the same time as state revenues started to decline and just sort of stabilize again after years of really strong growth in the wake of COVID-19. So in some states, we are already seeing policymakers rush to pass long planned spending cuts under the guise of preparing for the fallout for the passage of the harmful mega bill. But I think it's important to remember that these are separate things that are happening at the same time. And so finally, what can we do about it, right? I'll say, don't fear. All is not lost if we are willing to act really boldly. So three major things to focus on as next steps. I have listed out some state and local tax provisions here to particularly pay attention to, but I would say overall, document, which includes holding lawmakers accountable at both the state and federal levels, mitigate as much as you can, and try to build forward. So to reverse harm and really advance health and economic justice, we have to continue to beat the drum of what this bill will do and then show what it does as that harm unfolds. The bill is deeply unpopular, which is a necessary but not a sufficient condition for future policy change. But when people learn about it, they are against it. And the harm is going to unfold over time. Some things will happen quickly, like expanded work requirements and SNAP for parents and sharp premium spikes in the ACA marketplace coverage that are coming later this year. But some things will happen more slowly. And that slow burn is not an accident. Many policymakers voted for this bill despite the unpopularity of it in all the polls, in an effort to try and get past midterm elections and to sort of hide the ball on the dismantling of healthcare and food assistance that's happening later down the line. However, the rising health insurance premiums and energy bills are going to start hitting consumers by the end of this year, while families are already paying higher prices as a result of President Trump's ongoing trade negotiations. So to build more public and political will for better state and federal choices through this implementation period, people really need to hear how these policies are driving up their cost of living as they are facing the compounding hits to their pocketbooks in real time. So document it as it unfolds and remember that harm is both related to the individual provisions of the legislation and to what the state may cut in its state budget outside of these areas in order to pay for the cost shifts. And at the same time, there are opportunities to mitigate harm through the choices that states make, given how much is at stake for people and families. So there are interrelated decisions as Arkansas is going to have to figure out whether and how and by how much to mitigate the harm. Things like backfilling for federal cuts, how to implement work requirements, how to set up their systems so that the twice annual eligibility reviews for Medicaid expansion enrollees go smoothly, how to reduce the chilling effect for immigrants who remain eligible for a lot of programs and services. all of that. So this slide really focuses on state and local budget and tax decisions. But I would say to try to mitigate the damage, that the state should start working really immediately to identify additional revenue streams and avoid taking a cuts first approach. That is especially true for some of the most costly items in the federal bill that aren't going to take a full effect for another couple of years, which gives the state some time to plan. This should also include pausing or even reversing already planned personal and corporate income tax cuts and really revisiting the costly universal private school voucher program, in addition to seeking new revenue sources in Arkansas. States are going to need to revisit their budgets in light of the federal action. A number of states are considering or have already set special sessions this fall in order to tackle the impacts of federal actions and the plan forward, because there are a lot of trade-offs here. For example, states also conform to the federal individual income tax code in different ways. Arkansas currently selectively conforms to most provisions, but we need to be careful, and you should pay attention to what your lawmakers are doing and provide advice and support to ensure that the state doesn't opt into any federal tax provisions that are going to further strip revenues from state coffers at a time when you're really going to need them. And then finally, just laying the groundwork for better policies in the future isn't just about documenting harm and continuing the drumbeat about the bill. It is also about, organizing and building power and being clear with the public about what policymakers could be doing to lower costs, to broaden opportunity, to improve health and employment outcomes, and to lower poverty. So we are not starting from scratch. Advocates and the public are pretty clear on some of the things that families need to thrive, things like more affordable housing and childcare and energy. But it's important that we now work with state legislative and administrative policymakers, as well as advocacy and movement organizations, in order to shape better conditions for generational change. State priorities partnership organizations, so organizations in our national partnership, like Arkansas Advocates, have the longstanding relationships and the track record to help shape the state budget in ways that address the worst cuts, inform administrative strategies to minimize coverage losses, and really lead coalitions to raise significant revenue that the state is going to need right now. Focus on federal and state policymaking and just ensure that people and their well-being is centered in the policy conversations going forward. We are uniquely positioned for the fight ahead. Arkansas Advocates has lots of great folks on staff and really strong partnerships that can help the state to weather this, but it is going to be tough. And our team at the center is also here to support as it's helpful. Thanks.
Thank you so much, Whitney. That was a lot of really complicated information, but you did such a good job of making it understandable. And we will be answering some questions for those of you who have put some in the Q&A here in just a bit. We'll have time for that. But I just wanted to let y'all know that, the Center on Budget's website is just incredible in terms of the resources it has to really dig into a lot of this policy and to see how Arkansas compares to other states. So we will be sure, and when we send this recording out and the slides out, that we share those links with y'all, so you can, those of you who are interested in digging in more can do that. So thanks again, Whitney. And she's going to stick around for questions too. But just really quickly, I just wanted to remind y'all, I'm going to turn over to Pete in just a minute, but just to remind y'all that we really have made a difference in advocacy, and that it really does work, and just a few opportunities that we have going forward over the next couple of months. A good example of that is the work that we and our partners here in Arkansas have done to make sure that Compact of Free Association Citizens, that's COFA citizens, they're in Arkansas, it's mostly the Marshallese population. Those are lawfully residing migrants and immigrants in our state. And we along with them advocated very strongly that they continue to have access to SNAP and Medicaid, which they just have gotten access to in the last few years. And that was a success. And while we hated that other lawfully residing immigrants like asylees and other refugees are losing their SNAP and Medicaid benefits, we were at least glad that there was a carve out in this law that allowed Marshallese people to keep it. So advocacy does work. Educating our members of Congress and their staffs does work. So here's a few just examples over the next few months and years that we can make a difference. Back to this timeline that I showed you earlier, I just want to show you a few upcoming opportunities. As I mentioned, just very soon, we'll see refugees and asylees lose their SNAP benefits. We'll see those work requirements apply to a larger group of Arkansans. And so we'll be watching the way the state rolls out those changes, and we can make a difference in just ensuring that that's done in a consumer-friendly way, that people understand. Those of you who are at anti-hunger organizations or who serve people throughout the state can make sure you're getting the word out to people so they understand how to meet those work reporting requirements. We know a lot of people are going to lose benefits because it's too hard to go through these bureaucratic hoops. And so we want to make sure that we share as much information as we can with people. Another upcoming opportunity I mentioned, about a year from now, the state will owe about another $22–23 million in administrative costs to keep the SNAP program going just as is. So we will be in the fiscal session, sorry, that says 2025 fiscal session, but it's supposed to say 2026. In the 2026 fiscal session, next late winter, spring, we will all need to be advocating for the state to make sure they set aside more money in the budget to meet that need. Right now, the state doesn't have tons of money lying around because we're really, as Whitney pointed out, spending a lot of money on private school vouchers, on expansions to the prison system. But we want to make sure that this is a priority for our state lawmakers and that they know that it's coming. So we'll be working on that a lot in the coming months. And then in that 2026 fiscal session, we'll be watching that closely. And then going forward, and we'll be just trying to make sure Arkansans understand those new requirements that Whitney talked about, that, having to put their income information out, share that with the state more often, figuring out how to share their work hours so they can meet those work reporting requirements. As I mentioned, the federal law requires that to be January 2027, but Arkansas will actually probably implement some of those changes sooner. So we'll be watching over the next few months and year to see how we do that. And then the next one big opportunity in 2027 will be just ensuring that the state does set aside that $55 million, could be less, could be more, but if it were in place today, we would owe another $55 million just in the cost share for the SNAP program. The state has never had to pay a cost share that was to pay for the actual benefits in SNAP. This will be the first time this ever happens. And so we want to make sure the state is well prepared for that. And as someone mentioned in one of the Q&A questions, are we worried that the state will opt out of SNAP? It is an option for the state to opt out of SNAP. We hope that we would never get there. But we as advocates and people who care about these issues in Arkansas need to make sure that we're raising up our voices to be sure that they know this is really important. This is not something we need to lose, and to make sure we have the money set aside for that. And to hold accountable, our members of our congressional delegation who allowed this to happen, who voted to make sure that all these costs are passed on to Arkansas. And then another chance will be in 2028, the state will start. The state could be rolling out per service costs to people in the Medicaid expansion population. And those could be up to $35 per service, which will be a big chunk of money for low-income people whose incomes are low enough to be eligible for Medicaid. So the state will have some leeway in how they implement those and what the costs are. And so we want to make sure that the state does the best job with that really protects low-income people who otherwise wouldn't have access to a doctor. So again, these are just a few very specific opportunities and ways that we can be advocating in the upcoming legislative sessions. And I wanted to make sure to share those with y'all, and we'll be again around for questions. I'm going to turn over to Pete to share his screen and show you some of the maps that will allow you to look at this information a little more locally. Thanks, Pete.
Thanks, Laura, and thanks, Whitney, for all the great information. And thanks to all of you for attending today. Obviously, the important thing is for us to all understand what is happening here. Yes, I want to share a tool that hopefully will be helpful to you just for your own personal information or perhaps in your work. And I first want to show you how to navigate to the tool. When you get the follow-up email, I know that Rebecca will include a link, a direct link to the maps, but I'm showing you this because I hope you bookmark our page and also spend some time on our federal advocacy page where we'll be continually updating with new information. Okay, so our page is just aradvocates.org. And right on the home page, down here under the picture, you'll see a federal advocacy link. If you click on that, as I said, it will take you to a page with lots of really good information, and including some more detailed breakouts when we examine some of the issues that you guys have been asking about. But right here, you click on the One Big Beautiful Bill Act and how it affects Arkansas families, and you will get another page with more specific information. But here on the right, we have county maps. The county map page, don't worry if it takes just a little bit to load the maps. It's because they have lots and lots of data behind them, but worth waiting for because it's good information. Just a little bit of background, when we started talking about 1 trillion cuts to Medicaid, most of us as just human beings, that number is so huge, it doesn't really make sense. So we wanted to take that number and bring it down to the local level so you can see how this really affects your community. So this is a series of maps by county, and you'll see, for example, the very first map is a Medicaid dollars lost and the newly uninsured by county. The darker the color, the more lost. So you see the darker colors are really, really driven by population. But even in these lighter color counties, like if let's look at St. Francis, for instance, over the next 10 years, $123 million lost, and 1,400 Arkansans going to lose health insurance. So in a small rural county, that's not insignificant. So yeah, we could look at Little Rock and Pulaski County and say, oh, $1.4 billion are going to be lost. That's huge for, central Arkansas, but rural counties are affected as well. And we go down, similar map for SNAP, and you look and see where millions of dollars lost for SNAP. And Whitney previously gave you the total. But when you click on one of these counties, again, I'll look at Monroe County here, another rural county, $6.4 million of federal funding for SNAP. The next little information really is a multiplier that says, well, we know for every SNAP dollar, that there's a significant amount of money generated in the local economy. So it's not just that 6.4, it's the 9.9 to 11.5 million that will be lost because the SNAP dollars aren't driving that economics in local counties. And also the numbers. Now, these numbers of risk losing food insurance, that's that 25,000 that Whitney mentioned. She also talked about 240,000 will be affected in some way. So you can multiply these numbers by by 10 times and see that this really does affect counties, local grocers, employees, all of that kind of thing. The next map, simply a sum of those two things to show how the SNAP and Medicaid dollars will affect counties. So that's
Hey, Pete,
Jessica Summer.
sorry to interrupt you. Someone was wondering if you could blow up your screen a little more, possibly.
Yeah, I can try, then we won't be able to see all of it, but yes, let me see. And once you're in here, you can also zoom in on the maps yourself as well. So I certainly encourage you to play around with this. Okay, so hopefully that helps. Yeah, let me show you the next map. This one is, I think, especially interesting. So this is the percentage of Arkansans within a county that are covered by Medicaid. And you see, as it moves to yellow, that's the most. So let's look at Phillips County, for example. 42% are covered by Medicaid. So, almost half, right? 4 out of 10 or 2 out of 5 people living in that county get health insurance through Medicaid. And the dots are the hospitals, all hospitals in Arkansas, some of them rural, some of them urban. And so you see, for example, obviously a hospital like Progressive Health of Helena is really worried about these Medicaid costs because it's going to hit rural hospitals especially hard. To be fair, urban hospitals in central Arkansas, northwest Arkansas are not immune from this effect either. We know uncompensated care rates went down when we expanded Medicaid through the Medicaid expansion, and those amounts are going to go up. And so who pays for uncompensated care is a really important question. The last map we find especially interesting. This was the point when Whitney was talking about the uneven benefits of the extension of the tax cuts. And so you see here, this map has a slider. If I look at the right map, let's start here on the left. The number of people covered by Medicaid, the percentage, right? So that's similar to the hospital map I just showed you. And in this case, the darker the red, the more covered. And when I slide this over, this is the tax savings for those counties. And if you look carefully, you'll see the colors almost exactly flop from light to dark and dark to light. And then if we click on one of these, you get, let's see if I can do this with it zoomed in. I might have to come out a little bit on this one just to show you what the information is showing you. When I click on one of these, like if I click on, let's go again to Phillips County, it'll show that breakup that Whitney was talking about with the graph she used. What percentage? So 40% of households in this county make less than $25,000, right? And they're only getting $40 in tax savings. Where you come up here to, let's see if I can get to Benton County. Zoom in on that. This is hard with this, so you can all see. The vast majority of counties, almost 50%, are making 74,000 or more, which means they're getting the high end of that, up to 50,000, almost 50,000 in tax benefits. So you can see the cuts to places where Medicaid is an important supplier of healthcare, health insurance, are the places that are hurt the most. And those are the places not receiving the benefit of the tax cuts, the extension of the tax cuts. So I really encourage you to spend some time with the maps. Again, you'll be getting a link to those and see what this means for your specific county.
Thank you so much, Pete. We really appreciate that. It's one thing to talk about these big numbers nationally, even big numbers at the state level, and not really understand the impact, but to be able to drill down to your local community and really see not only how many people might lose their Medicaid benefits or SNAP benefits, but also the upside down nature of those tax cuts at the local level is really powerful. So we encourage everybody to go to those. We'll send you the links to those as Pete said, and we'll be sure that you can have those. But we wanted to make sure that we have some time for questions. And we've seen several already. And maybe Rebecca or someone else can help me if I miss any, but a few, I'll get us started with a couple of them here. Can you explain in more detail how food benefits will be taken away from lawfully present immigrants? I think since this question was asked, we might have gotten into a little bit more detail, but just in case, almost immediately, like now, and as the state changes its eligibility forms and that type of thing, people who are lawfully present immigrants who have access to SNAP will lose those benefits unless they meet a couple of very narrow categories. Thankfully, one of the narrow categories covers people born in the Marshall Islands who are lawfully residing here. But other folks who've come and who are refugees who've arrived here recently, through organizations like Canopy and others, those folks are going to lose their SNAP benefits almost immediately. And so I hope that helps answer that question. In a question, hey, Bruno asked a question. The $82 million cost to the state was just from the cuts from the One Big Beautiful Bill Act, or was that inclusive of all changes? Do we have a breakdown of how much each policy change will cost each state? I think I might try and defer that to Whitney and or Pete, just to make sure I don't say something wrong. Who wants to tackle that one?
The 82 million that I noted on the slides was just in food assistance costs that are shifted to the state. So that's just for SNAP. And then we do have breakdowns of estimates for other costs, but not all of them, right? So like there are lots of minor tax provisions that haven't been modeled yet, but like for the major things like the Medicaid changes, for the SNAP cost shifts, we do have estimates of that. And I put a link in the chat to the Center on Budgets fact sheet for Arkansas as well. But we have lots of other resources that I will send the link to the Arkansas advocates team so that they can get it out to you. And if you have any additional questions, I'll also put my email address in here if you're trying to figure something specific out.
That's great, Whitney. Thank you.
If I can add really quickly, this is really, really complicated, right? There's a lot of hidden costs that won't show up in these sort of more straightforward calculations. So people have posted their concern about rural hospitals. So when a rural hospital closes, that's not just, a loss for the hospital itself, but it's often the largest employer in town, right? And so all those people are suddenly without work, all the employees, right? And citizens within that county are now having to drive a lot farther for emergency care, right? What about, as I mentioned before, uncompensated costs? So UAMS, the medical hospital, medical school in Little Rock, it's going to see its uncompensated care go up. So who pays for that, right? So there's all these additional costs that have to be borne by someone. How much does the state step in? How much does this cost us as citizens are really good questions. So yes, these more straightforward numbers are important, but we also got to remember there's lots of other additional costs when we see this kind of federal aid go away.
Yeah, that's a really good, important point. Thank you. There's another question here about ESSER funding, and I'm just going to readily admit that I'm no expert, even close to an expert, or even maybe even a non-expert in that area. But Whitney, did you want to try to answer that one, or we could always follow up if we don't have a specific answer right now?
Sure. So we don't track it at the Center on Budget, but the Council of Chief State School Officers has put out something on this. So I just dropped that into the chat for you. And that has a breakdown of various different forms of spending that different school districts had.
That's great. Thank you so much, Whitney. Always ready with all the great resources to click on. I appreciate that. I see a question about the child advocacy centers and the budget cuts. I think that a lot of our nonprofit partners are facing a different type of budget cuts from the federal government that aren't related to this bill. And so we're all going to be needing to be advocating to make sure that that important programs like that don't lose funding. But it's outside the scope of this bill, unless there's some way that it affected child advocacy centers that I don't know about. But
well, I'll say really quickly, this is Rebecca Zimmerman.
Sure.
With Arkansas Advocates. I am trying to organize a webinar with a national group about appropriations and how that and other cuts that have happened will impact nonprofits. And I'll hopefully we'll get that organized and as quickly as possible, but keep an eye out for an email about that in case we do or are able to do that.
Okay, thank you. And I saw a question about were there working age requirements for Medicaid. We tried to implement some back in 2018, and a federal judge said that those weren't allowed, but now of course they will be allowed because the federal law has changed through this bill and through this law. And so there weren't before nationally, but some states had experimented with them, and Arkansas had requested to put some into place even before this bill passed. And so we'll see how the federal administration handles that and when ours go into place, but we didn't have any before. But most people are working. It's just a matter of going through those bureaucratic hoops to show that they are. How are states similar to Arkansas handling? Because this is all really new. And so all the states are kind of trying to figure out exactly how to handle this, just like we are. I don't know if Whitney, if there's anything more specific on that one, but everybody's just trying to figure it out.
Yeah, they're all doing different things. I will say a lot of states are calling special sessions, and some of them are creating like trust funds for different communities to cover their health coverage over time, especially like specific immigrant communities. But the responses are really all over the map. Some states are unfortunately taking a really bad tack and like immediately rolling back expansions to things like their state level EITCs or child tax credits, or starting to already propose cuts from agencies and to ask them for like across the board cuts just to consider for their next budget negotiations.
Yeah, this is a good reminder. That reminded me, Whitney, that some states have been more generous in their social safety net programs than Arkansas has been. And so there actually is an opportunity to make some cuts. But we have historically not done that. We have some of the most restrictive eligibility levels, like in SNAP, across the country. And so we won't have an ability to save in the program by cutting. We're going to have to just make sure that the state sets aside that funding. And it reminded me earlier, you said something about like revenue raising. Whitney was talking about that's a state option, that, you could raise revenue, which means raising taxes in a way that, can pay for some of these changes. That doesn't seem likely in Arkansas, but it is a good opportunity to remind our lawmakers and governor and others that we should not be doing, more rounds of income tax cuts at the state level to fight those very hard, because all these new expenses are coming in addition to the other ones we've already added to our budget.
Hey, Laura, I'm going to take over because there were some earlier questions in the chat that haven't been answered yet. Can y'all talk very quickly about how work requirements are changing for elders, older adults, please?
Sure. So as Laura mentioned, since there weren't federal work requirements before for Medicaid, now there will be, but they will apply for people who are 19 through to 64, which is, as I put in the chat, even older than the work requirements that Arkansas tried earlier and that failed and that they then took away. So older adults will be eligible then. And then there's also specifically with the SNAP provisions, parents of children who are over 13 will now also have work requirement restrictions.
And in the SNAP program, the work requirements in Arkansas went up to 55, and now they're going to go up to 64. So that's that new population, and not very old, since we won't call anyone 55 older, too much older. But I know we're running out of time. Rebecca, do you want to try to do a couple more, or do you want to? What do you want to do?
We can try to do a couple more, and maybe we can stay on and answer as many as we can, and people can drop off if they need to drop off. But if we are not able to get all the questions, we can send an email follow-up and try to answer those. We've had a couple different questions about providing resources to people who are directly impacted. Arkansas Advocates is trying to create some fact sheets that are useful for people who do have these benefits, to explain how they can keep their benefits and what decisions they might need to be making, but also a question about referring to other resources. We can share information about other statewide nonprofits that do provide direct community services. However, because of things happening federally, also are getting kind of severe cuts, and might get even more severe cuts next month during the appropriations process. So people who are low income are really being hurt in many different ways right now, and it's going to be very difficult for them, and we all just have to be as supportive of our neighbors as we can be in whatever way we can be. I think we also have a question, and yes, sharing information. We need to get this information out. What we saw when the work reporting requirements happened with Medicaid in Arkansas several years ago, so many people didn't know that they were required to do this for various reasons. And it really, one big way we can help our neighbors is making sure that we share this information as widely as possible.
Hey, Rebecca, sorry. I saw one
Yes.
about what can rural hospitals do to keep from getting closed. And I think that one thing I didn't mention, I can't remember if Whitney did or not, but in coming in, I think it's October or November, but this fall, the state will need to apply to become part of a rural hospital fund. And so we need to make sure, and I'm sure that our state officials will be on top of that because it's funding that can come to the state. But just in case, we'll want to make sure and advocate that we become part of that rural hospital fund so we can protect. It was kind of to try to get some of the rural senators to vote for it. They created this fund to try to say that we're going to protect rural hospitals with this fund. It's not enough money for sure. But Arkansas can apply to draw down some of that funding. So we'll make sure and advocate for that.
And I think no more questions, people. We're at the end. No, it's okay. If you have more questions, you can always email us afterwards. But two more questions really quickly for those who can stay on. How are these changes going to impact young adults exiting the foster care system? And will there be any changes for them?
Yes, they will be subject to work reporting requirements. They used to be, like, for example, in the SNAP program, they used to be exempt if you were aging out of the foster care system, or you were experiencing homelessness, or you were a veteran. You were exempt from those work reporting requirements. They kind of recognized that those are populations that might be struggling more. But those exemptions are no longer in place. So veterans, people experiencing homelessness, and people aging out of the foster care system will have to meet the work reporting requirements, just like everybody else. Those exemptions were taken out of the bill. Taken out of SNAP policy.
And one last question, when will the strikes begin? Well, I'm not aware of any national strike program related to this right now, but there are several national grassroots groups doing various actions, including weekly protests, including the Poor People's Campaign. And there's one other that's quite prominent, but do any of you remember their name that do like the weekly coordinated protests?
I don't know.
There's another one. I'll try to remember their name and let y'all know. But that was it. That was all we've got.
Thank you,
Laura. I'll let you close us out.
Okay, thank you again, especially Whitney, for joining us from DC today, to my colleague Pete, and to Rebecca, and to all of you who joined us and stayed on till the end. We went a little bit over, but only because of your great questions. So please stay tuned. Go on our website at aradvocates.org and sign up for our email newsletters. A lot of you are probably on that because you're on this call today, but just want to make sure everybody stays engaged, and we'll let you know as these opportunities come forward to really be making good arguments to defend these really important programs. So thank you so much.